Hi, Kevin Henry, the Group Editorial Director for Advanced Star and Modern Hygienist, and I'm on a Google Hangout today with America's Dental Hygienist, Anastasia Turchetta. Hey, Anastasia, what's up?
Hey Kevin, just enjoying the sunshine. How about you?
Good. Hey, good for you. I want to talk to you about a topic today that you and I chatted about a little bit offline. I thought it'd be good for you to share some information with our viewers, I should say, and that's the role of the dental professional whenever it comes to migraines. And Anastasia, talk to me a little bit about that. Because at first glance, maybe we don't see the connection between migraines and the dental practice. But tell me what it is.
It's very interesting because I still have to check myself, and that's why I enjoy doing these. The thing of it is when we look on the health history, and it always starts there in the health history, many patients will say they suffer from migraines, and our immediate reaction is to look at the medication that they're taking. Because then, of course, clinically, I feel many of us will say, oh, if you're taking this, you could be prone to dry mouth if they're taking other medications. And I understand that, but it seems to me we're still kind of missing the importance of that health history with migraines. And June is Migraine Awareness Month. So here are some things I feel we need to go once you ask the patient about migraines. We need to take it a step further. So how long have you been experiencing migraines? How long have you been taking this prescription medication? Have you noticed any, facial pain or ears, like tinnitus, ringing in your ears? Any clenching of your jaws? Where else is the pain going? Because really, it does start there. That trigeminal nerve, it's a hot spot, and that's really very well connected compared to other areas of our body. So we need to ask that. And the other thing, Kevin, is asking more questions like, have you been in a car accident? If you were playing soccer, have you had any sports injuries? Whether it be they fell and they were a cheerleader or something, very similar. People don't think that that contributes to migraines, but it does.
So it's all about bringing it up in conversation. Is it just as simple as asking a question, or what would you recommend?
It's not simple because to me it would be like, oh, everybody's going to be doing it. I think it really comes from awareness, and if it takes making a checklist and saying, you know what, our practice is going to help out more in this area. It's no different from, it's no different from sleep apnea, and that's starting to make a splash. So really, it's just about awareness.
And I've said this before, and I'll say it again. The one thing that, no matter what our subject is, it always comes back to education and the dental professional really being willing to ask those questions and maybe stretch those boundaries a little bit in the practice, right?
Exactly. And a good friend of mine who is a leadership coach has always said it's not about if we're able to do it, because we're all able to do it. We've passed our boards and we put in our time. It's, are we willing to do it? Because it's the action that really creates the movement to where your dental practice goes as far as services provided.
So let's talk about that action then. So I'm a dental patient. I've come into your practice and I said, you know what? I was in a car accident, and now I do get migraines. What do you do? What's the next step?
Well, there's a couple of things that you can do. One, some practices are not prepared to address migraine. So of course I think our first resort is to send you to a neurologist and get a scan and do all the things that seem to be normal within the medical industry. But there's a treatment out there that I've literally witnessed, and it has helped people. It doesn't help everybody, so I'm gonna before people start of course, oh, this is the one size fits all. There is not a one size fits all. However, if you think about it, it's called Denna. It's basically sports medicine. So whatever we would do on an athlete for their knee joint, we're doing on their jaw joint and their face. So it's a couple of different treatments, and we're basically taking that scar tissue and removing it. So people don't realize all the tension that creates around your head, but you'd be surprised. So after multiple treatments of this, it's almost like a massage for the patient. Then the patient literally, I have seen some of them go off the prescription medications, and you know what? That's actually healthier, and you help to contribute to that.
That's real interesting. So the company's called Denna.
It is called Denna. They go in for a couple of, first what they do is they assess your bite, because you know what? Biting could be a great cause of tension. Think about it. We don't know that we do it, and sometimes with grinding our teeth, or if you've had an accident and your bite's just off, we do it in ortho. We check the bite. Why aren't we doing that every time with our patients and seeing where they're opening and closing? So they assess your bite. They assess the range of motion, so taking your headphone all the way back and taking it down to your chin and side to side. And they assess that, and they assess how wide you can open. Because the goals after each treatment are to get more range of motion for you to live a healthier life. So it's kind of like almost like ultrasonic therapy, if you've ever seen that, and then it's kind of like a laser therapy meets massage therapy. Just bundle that all up into a sports medicine kind of package, and that is the really cool feature that True Denna has.
Nice. Always good to know, and always good for our dental professionals who watch these to know what to watch out for and when to have that conversation and how to even kick things off in the dental practice. So,
Absolutely.
Anastasia, hey, really appreciate the time, and as always, good information. Thanks so much.
Thanks for having me, Kevin.